Okay, this is Unit 5 in Hematology, and this is week 13. We're going to talk about coagulation disorders. These are um, disorders in which people um, lack one or more of the factors, and there's also some others in this section too. I'm not going to read all of these results to you because I think it's redundant. You can read them for yourself, but you do need to know all of these results for each individual deficiency. Um, for the first one, factor 1 is also known as dysfibrinogenemia. Factor 1 is fibrinogen. For the laboratory evaluation, um, if you know which pathway that the factor is found in, and if you know which pathway is um, is tested in the PT and which is tested in the PTT, you can figure out what the results are going to be. And that's what I would do if I were you, instead of trying to memorize all of these results. Um, since factor 1 is found in the common pathway, then both the PT and the PTT is increased. Fibrinogen is decreased and the bleeding time is increased in half of the cases. Even since this is not a platelet disorder, the bleeding time is still increased, which is significant for this deficiency. Factor 2 deficiency is in the common pathway, so both of them are increased. The fibrinogen is the same because this doesn't affect the fibrinogen. And factor 2 assay is decreased. So what that is a test to check the level of the patient's factor 2, and it will be decreased or absent altogether. Okay, factor 5, it's in the common pathway. They're both increased. The factor 5 assay is decreased. Factor 7, 7 is in the intrinsic pathway, and the PT tests for the intrinsic pathway. So the PT is going to be increased and the PTT is going to be normal. Factor 8 is the same thing as hemophilia A, which is the most common type of hemophilia. There is other ones. This one is in the intrinsic pathway, and the PTT tests for that. So the PTT is increased and the PT is normal. Notice the factor 8C, which is a fraction of the factor 8, is decreased. Okay, this is factor 9, which is hemophilia B. This one is not as prevalent as hemophilia A, and it's also called the Christmas disease. And that factor is also known as the Christmas factor. This one's in the intrinsic pathway, so the PTT is increased. The bleeding time and the platelet count are normal because that's for platelets, and this is not checking. I mean, this doesn't have a deficiency to do with platelets. The factor 8C is normal because a lot of these patients, you would think that the patient has hemophilia A because A is more prevalent than B. So the doctors will check 8 first, and that will be normal. So then he would go to factor 9 assay, and that would be decreased. Okay, the factor 10, it's in the common pathway, so they're both increased. This is hemophilia C, which is factor 11. It's the PTT is increased. It's in the intrinsic pathway. Okay, this one is von Willebrand's disease. It's also known as parahemophilia, and there's different forms of this. Some of the diseases are worse than others in patients. The PT is normal, the PTT is slightly increased. The bleeding time is increased because the von Willebrand factor is needed in platelet adhesion, and it's not there, so the platelets don't work properly. The aspirin tolerance test is increased. Platelet count is normal. Factor 8 is normal to decreased, and von Willebrand factor assay is decreased. Okay, these are inherited. Now, all of these factor deficiencies that we've talked about so far, these patients all have bleeding issues. Usually it starts out like with a nosebleed, or they get cut and they don't heal fast and they continue to bleed. The ones that we're going to talk about now, these disorders cause the patients to be more at risk for having a clot instead of bleeding. Factor V Leiden is a very common disease, and I know somebody that has this or did have this, and she actually died from a pulmonary embolism. So it's rather common. It's inherited. The patients usually have venous or pulmonary emboli. PTT is normal. It's a common genetic mutation. It causes factor V to be resistant to protein C, and protein C is needed also. Oral contraceptives like birth control and smoking increases the risk. It's usually discovered in women who are about 20 years old. It's diagnosed with a D-dimer so the doctor will know that there's a clot there, ultrasound to find the clot, and factor V Leiden assay, and so that would be low. So when this is usually discovered is when the patient has a clot. Okay, protein C and S, these are usually venous clots. The PT and the PTT is normal. Each protein assay is decreased. So when we check protein C, it's decreased, and S is decreased. Antithrombin 3, this is a deficiency. Antithrombin 3 is a natural anticoagulant that we have in our bodies, and it helps to prevent us from having clots. These patients lack that, so they tend to have clots, and they have venous and pulmonary as well. Their PTT is normal, but their antithrombin 3 assay is decreased. Okay, acquired bleeding. These bleeding disorders are from other things that are going on with the patient. So these are secondary to something else. Like the first one is liver disease. Since most of the coag factors are made by the liver, when the liver is damaged, it's not working properly, the coag factors are not being made. So this can be seen in cirrhosis or hepatitis, liver cancer, anything that's going on with the patient's liver. They'll have hemorrhage, purpura, and petechiae on their skin. Their liver enzymes are increased. Their bilirubin is increased because they have liver damage. Their PT is increased, but their PTT is variable, so it can be normal or increased. Okay, hemolytic disease of the newborn. This happens when a baby's liver is immature. There's limited vitamin K, and there's inadequate normal flora in the intestines producing vitamin K, and vitamin K is needed in clots. Their prothrombin factors cannot be produced. These babies usually have umbilical stump bleeding, where their umbilical cord is cut in their belly button. Cephalohematoma, which is a brain bleed, jaundice, and bleeding after circumcision. So this is diagnosed, of course, right away. Their PT is increased, their PTT can be variable, their bleeding time and platelet count are normal because it doesn't have anything to do with platelets. Okay, sterile gut syndrome. This is, notice it says sterile gut. This is seen in patients who are in or on antibiotics for usually a long extended amount of time, and they're usually strong antibiotics. And the antibiotics destroy the normal flora in the intestines. We need the normal flora to make vitamin K. The vitamin K is needed in clots. So the factors that need the vitamin K are not able to work properly. So this is usually seen when they have mucosal bleeding or bleeding from venipuncture, bleeding from IV sites. And the key is they've had some kind of infection and they've been on strong antibiotics for a long period of time. The PT is increased, the PTT is normal or increased. It's variable. Okay, we've already talked about DIC. This is secondary to something else that's going on in the patient, and we've already talked about this. It can be a lot of different things. Preeclampsia in pregnancy, toxins. It's secondary. Usually what happens is the patients form clots, and then they start to bleed. So there's clots that are formed. The factors are all used up. This activates the fibrinolytic system, and then it leads to bleeding. The patients have purpura and bleeding. The PT, PTT are both increased. The fibrinogen and the platelets are decreased. Those are used up. The FDP or FSP and the D-dimers are positive because those are the tests that check for the breakdown products of clots. D-dimers and FDP is the #1 test that is used to diagnose DIC. On the smear, there's fragmented red cells. Treatment, this is very hard to treat because you're trying to treat a bleed and a clot at the same time. The clotting stage can be treated with heparin, and the bleeding with FFP, and it's just very difficult to treat. On the last 2 pages, there are 2 very, very good charts that you need to study. Let me know if you have any questions.